The need to determine a patient's competency is important when looking to gain informed consent and providing treatments. Without confirming the patient's competency, it is impossible to tell whether they are truly making informed decisions about their treatment options. This is particularly important in cases where the patient wants to refuse treatment, or their choice has the potential to be harmful, or that in a competent state, the patient would choose a different option. According to the Wellington Free Ambulance Clinical Procedure Guidelines and supported by the Assessment Guidelines in the Paramedic Principle textbook, there are certain criteria that need to be met in order to ascertain a person's competence. The criteria includes their ability to understand the information presented to them, whether they can remember it, and their ability to understand the consequences of their decisions. Added to this list by the Wellington Free Ambulance is also whether the patient has attempted suicide or has expressed serious thoughts of it. The need to establish competency in order to gain informed consent is required by law for all patients in New Zealand. This can be found in the New Zealand's Health and Disability Commissioner regulations under the Code of Rights for Consumers. This is right number 7, subtext 1. Unless there is reason to doubt a person's competency, it should be assumed. This is number 7, subtext 2. This video will look at one situation where a person's competency is in doubt, and what can be done to assess their level of competency in relation to their condition. This is John. John fell briefly unconscious after a blow to his head from an elephant tail. Because of the potential for a head injury or concussion, it is impossible that John may no longer be in a competent frame of mind to be able to make decisions about his care and treatment. This is Shompi. Shompi is a paramedic, and it's her job to decide how competent John is and to provide the best level of care that she can. She will start by introducing herself and building some rapport with John. She will ask him some questions to determine his competency. Because of the nature of the blow to his head, it is unlikely that John is at risk of self-harming, and Shompi will therefore not ask questions relating to this. Questions that should be asked are those relating to John's memory, understanding of events, and the future consequences of his decisions. In this case, she will start by asking questions relating to John's memory, but still leaving a normal amount of time for John to answer. If John passes the memory test, it is then important to see whether John has understanding of the potential effects of concussion or head injury, and any information provided by Shompi. If John has confidently shown understanding of all the information presented to him, and has been able to remember and recall all information freely, it is then important that John can understand the consequences of his decisions. And most importantly, he has an understanding of what could happen should he choose to decline treatment. It is not just questions and answers that can cause someone to be deemed incompetent. If John took longer than normal to answer these questions, or was behaving in a way that could be concerning for Shompi, then John could still be considered incompetent. In these cases, it is valuable if there is a family member or close friend around that could distinguish his behaviors as normal or potentially as a result of a concussion or head injury. If at any point along these questions John is found to be incompetent by Shompi, it is then her job to make the best medical choices on his behalf. These choices must satisfy 3 criteria. 1. That the treatment is believed to be in the person's best interest. 2. That the benefits of the treatment outweigh the risks of not providing the same treatment. And 3. That it doesn't contradict a valid advance directive, which in John's case is not a concern. These are all the things that need to be considered when approaching someone that may have some form of temporary or permanent cognitive impairment. The end.